Hello and welcome to our channel Nuturemite, where we provide informative videos regarding health and lifestyle. Please like, share and subscribe the channel and click on the bell icon for important notification and videos.
The sudden weight loss in your body. Weight loss can be intentional, such as from dieting and exercise, or unintentional and be a manifestation of illness. Weight loss can result from a decrease in body fluid, muscle mass, or fat. A decrease in body fluid can come from medication, fluid loss, lack of fluid intake, or illnesses such as diabetes. A decrease in body fat can be intentionally caused by exercise and dieting, such as for overweight or obesity. Weight loss is normal after pregnancy. Other causes of weight loss include, but are not limited to, cancer, viral infection, parasite infection, depression, bowel disease, and overactive thyroid. The loss of weight and lack of nutrition associated with a chronic illness is referred to as cachexia. Unexplained, unintentional weight loss is often a result of illness and should be evaluated by a healthcare professional. Most people are very aware of the dangerous consequences of weight gain, and many articles focus on ways to lose weight. However, unintended weight loss can also jeopardize a person's health or indicate an underlying medical condition. People may gain or lose weight in response to seasonal changes or when facing important or stressful life changes, such as moving home or starting a new job. However, a person may wish to see a doctor if they experience significant weight loss that has no clear explanation. Unexplained weight loss has many causes, medical and non-medical. Often a combination of things result in a general decline in your health and related weight loss. Sometimes a specific cause isn't found. Usually, an unrecognized cancer will have other symptoms or abnormalities of laboratory tests in addition to unexplained weight loss. 11 potential causes of sudden weight loss in your body. First, hyperthyroidism. Hyperthyroidism occurs when the thyroid gland produces more hormones than the body requires. People sometimes refer to this condition as an overactive thyroid. The thyroid produces certain hormones that regulate the body's metabolism, so an excess of these hormones often causes the body to burn more energy than usual. Burning more energy and calorie can lead to unintentional or unexplained weight loss. Other symptoms of hyperthyroidism include fatigue, tremor with shaking hands, muscle weakness, difficulty sleeping, rapid heartbeat, changes in mood such as an increase in irritability or nervousness, diarrhea, a swelling in the neck called goiter. Second, depression. The symptoms of depression can also cause weight loss. In a 2017 prospective study, researchers examined the cause of unexplained weight loss in 2,677 adults. They identified depression as a underlying cause in 7% of the participants. According to the researchers behind a 2016 study, there is evidence to suggest that people with depression may have associated suppressed interplay among the hypothalamus, pituitary gland, and adrenal glands, which may affect the function of gastrointestinal tract. Changes to the hypothalamus and pituitary gland can also affect the adrenal gland, which produces multiple hormones. These hormones include cortisol, which helps regulate blood pressure, blood glucose level, and metabolism. Other symptoms of depression include persistent or recurring feelings of sadness, hopelessness, or apathy. Changes in appetite, such as eating more or less than usual, unintentional weight loss, or weight gain. Third, Addison's disease. Addison's disease is most commonly due to a rare autoimmune disease that harms the adrenal gland and prevents them from producing enough cortisol and aldosterone. People who have Addison's disease might notice a decrease in their appetite as well as unexplained weight loss, according to the National Institute of Health. Other symptoms of Addison's disease include fatigue, nausea, low blood pressure or hypertension, dizziness, muscle cramps, abnormally darkened area of skin or hyperpigmentation, low level of sugar and sodium in the blood, high level of potassium in the blood, low red blood cell count or anemia, high white blood cell count, typically due to too many eosinophils. Fourth, inflammatory bowel disease. Inflammatory bowel disease or IBD refers to inflammatory gastrointestinal condition with immune system dysfunction, that is Crohn's disease and ulcerative colitis. Crohn's disease can cause inflammation in any part of the gastrointestinal tract from the mouth to the anus. Ulcerative colitis, on the other hand, only affect the large intestine. IBD can reduce the body's ability to digest food properly or absorb nutrients, which can lead to malnutrition. Weight loss is a common symptom of both conditions, especially among younger people. Other symptoms of IBD include frequent diarrhea, abdominal pain, bloody stools due to GI tract bleeding, fatigue, fever. Fifth, muscle loss. Muscle loss, also known as muscle atrophy, occurs when the muscles shrink or waste away. This condition can cause unexplained weight loss. Possible cause of muscle loss include inactivity due to an injury, malnutrition, aging, stroke, multiple sclerosis, amyotrophic lateral sclerosis or ALS. People can often prevent muscle loss through proper nutrition and regular exercise. Physical therapy after an injury or stroke may help reverse or prevent muscle loss. Sixth, rheumatoid arthritis. Rheumatoid arthritis RA is an autoimmune disorder that causes inflammation in the joints. Although the Arthritis Foundation estimate that 2/3 of people who have RA are overweight or have obesity. People who have RA may experience weight loss. This weight loss may occur because the chronic inflammation that RA causes forces the body to use more energy. In addition, people who have RA may experience muscle loss because of the inflammation in their joints keep them from engaging in the regular physical activity. Some medication that people take to treat RA may cause side effects such as diarrhea and loss of appetite, which can also contribute to weight loss. 7. Cancer. Although cancer symptoms tend to vary depending on the type, stage, and location of the disease, but still, unexplained weight loss is sometimes a sign of cancer. Cancer refers to any disease in which abnormal or mutated cells rapidly multiply and eventually invade healthy tissues. Weight loss is especially common in lung cancer and cancers that affect the digestive tract, such as pancreatic cancer, colorectal cancer, stomach cancer, liver cancer, bile duct carcinoma, esophageal cancer. Other early symptoms of cancer to pay attention to include fatigue, fever, pain, digestive issue, changes in bowel or bladder function, skin changes, and a persistent cough. 8th, chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease or COPD is a progressive lung disease. This includes emphysema and chronic bronchitis. Many people with COPD have both. Emphysema slowly damages the air sac in your lungs, making it hard to breathe. Chronic bronchitis causes inflammation of the airways that bring air to your lungs. This produces mucus, coughing, and breathing issues. Early COPD is mild. Some people may not show symptoms, but those that may appear include shortness of breath, wheezing, chest tightness, mild coughing with or without mucus. In later stages, COPD can cause weight loss. Labored breathing burns a lot of calorie. A person with COPD may need 10 more times more calorie to breathe than a person without COPD. It can also feel uncomfortable to eat and breathe at the same time. Symptoms of severe COPD also include swelling of legs, ankles, or feet, low muscle endurance, fatigue. The main cause of COPD is cigarette smoking. Long-term exposure to irritants such as air pollution and dust can also lead to COPD. Treatment includes medication such as bronchodilators and lung therapies like oxygen therapy. 9. Endocarditis. Endocarditis causes inflammation of your heart's inner lining or endocardium. It develops when germs, usually bacteria, enter the bloodstream and collect in your heart. Most people with endocarditis have a fever. This may come along with a poor appetite. Elevated body temperature also increases metabolism and burns fat, causing weight loss. Other symptoms include heart murmur, coughing with or without blood, abdominal pain, chest pain, difficulty breathing, night sweats, back pain, headache, red or purple spots on the skin. Endocarditis is rare in healthy hearts. It's most likely to affect people with damaged heart valves, artificial heart valves, or congenital heart defects. Treatment of endocarditis includes antibiotics and surgery. 10th, tuberculosis. Another cause of unexplained weight loss is tuberculosis or TB, a contagious condition that usually affects the lungs. It's caused by Mycobacterium tuberculosis bacteria. Weight loss and decreased appetite are major symptoms of TB, but the reasons aren't fully understood. TB spreads through the air. You can catch TB without getting sick. If your immune system can fight it, the bacteria will become inactive. This is called latent TB. Over time, it can turn into active TB. Symptoms include bad cough that lasts 3 weeks or more, chest pain, coughing up blood or phlegm, fatigue, night sweats, chills, and fever. Some people are at risk for active TB. This includes people with weak immune system, especially those who have low body weight, substance use disorder, diabetes, silicosis, leukemia, Hodgkin skin disease, HIV, organ transplant. TB is typically treated with the course of antibiotics for 6 to 9 months. 11. Congestive heart failure. Weight loss is a complication of congestive heart failure or CHF. CHF develops when the heart can't fill up with enough blood. The heart can't pump blood with enough force or both. It may affect one or both sides of the heart. If you have CHF, your digestive system can't receive enough blood. This can lead to nausea and early fullness. Additionally, it might be hard to breathe while eating. The inflammation in damaged heart tissue also speeds up metabolism, causing unintentional weight loss. CHF symptoms also include shortness of breath, persistent coughing, swelling, fatigue, fast heart rate. There are several medications used to treat CHF, including angiotensin converting enzyme inhibitors, beta blockers, and diuretics. In some cases, surgery might be necessary. The conclusion: men versus women. Compared with women, men have a higher rate of endocarditis, pancreatic cancer, lung cancer. Women are at higher risk for COPD. Women are also 2 to 10 times more likely to develop hyperthyroidism and 2 to 3 times more likely to have RA. When to see a doctor? It's normal for your body weight to fluctuate. However, if you are losing weight without changing your habits, something else might be going on. If you experience a 5% weight loss in 6 to 12 months, or if you notice any of the above symptoms, visit your doctor. So thank you guys. If you found this video useful, hit like, share and subscribe to our channel Nuturemite, and don't forget to hit the bell icon.
Thank you. Please like, share and subscribe to the channel. Click on the bell icon for important notifications and videos.